If you would explain to me the difference with your technique and the FUE, if he came in for an FUE, relative how many hairs he would have got with that method versus your method, and what they would have done to his donor area to prepare for it, and what area they would have accessed.
Absolutely. What happens is when follicular unit extraction is done, they will only use follicular units. They use a tiny punch biopsy instrument that'll pull hairs out in that follicular bundle, which will only yield anywhere between 1 to maybe 3 hairs at most. Well, because to get a lot of density out of a follicular unit extraction, you have to use a very large area in order to harvest the hair from. So a lot of times what they have to do to get a large yield is they have to pull from areas that are susceptible to the hormone conversion that causes the loss. So because they can't take two follicular units out right next to each other, because then it'll leave a bigger area which will cause a larger scar. Each time you take a follicular unit extraction, what happens is that area comes out, where that little tissue comes out, and then that will scar and leave a little polka dot scar. So they call it a scarless surgery. In actuality, you have more scars than you would by doing one linear suture line. And the reason for that is because you take it from all over the place, which causes more fibrotic adhesions and more scarring underneath the surface of the skin. Even though you don't see it, it's underneath there, which causes problems when you do a future transplant, because it changes the underlying vascularity and it changes how those underlying follicles will be harvested on your next procedure. So that will in effect limit your overall yield the next time you do a hair transplant. So if they were to do a big follicular unit extraction case, let's say they pulled out, I don't know, let's say they pulled out 2,000 follicular units. Well, if the average follicular unit has, let's say, 2 hairs in it, you might yield 4,000 hairs, and that would probably take days to get that done. Vito, how long was your procedure?
4 hours.
4 hours. So we did 4 hours, and we did the max harvest case where we did a linear suture line, and we harvested probably well over 7,000 hairs. I don't remember the numbers off the top of my head, but I'm pretty certain we yielded pretty close to about 7,500 hairs. So almost double what they would get in a simple follicular unit extraction case, for obviously a much better result with leaving the patient with more donor area to transplant later.
And also that method of removal is very poor as far as the survival rate, correct, between the two methods and techniques?
Yeah, when you use a follicular unit extraction method of harvesting donor hair, you will get less of a yield due to the fact of how it's done. You're taking a punch biopsy, and you're blindly taking that punch biopsy and trying to harvest hair without being able to see what you're doing. So what happens is the follicles will get transected. Also, they get nipped when you put that little punch biopsy instrument in there, and then when they pull it out, a lot of times they'll lose the bulb of the follicle. Well, when you're doing just a regular linear suture line, you're able to see exactly what you're doing. There's less of a chance of transection, which for the consumer, that means you're going to be able to get more hair.